How's it going, Curry County? I'm Michelle Carrillo, and it's great to be back with this third virtual town hall. So I've had the privilege of growing up in this beautiful place and now getting to raise my two children here as well. My daughter is 10 and my son, who's a year and a half old now. I work for Wild Rivers and Humboldt Area Foundation as the Director of Community Solutions, Strategy, and Programs. And as the leaders that came before me have known since the beginning of time, our communities don't always recognize state lines, and this place is connected by our rivers and oceans and people. I want to take a moment to recognize the place that I'm joining you from today is known as Houndquet by the local tribe Halawadeni, and that as each of you join from your homes this evening, we're all in a place that is current ancestral homelands of our local tribes. And over the last 2 years, our staff have had a unique position of supporting organizations across Curry, Del Norte, Humboldt, and Trinity counties as we have all responded to this pandemic. And we're really honored to have the opportunity to work with this group of leaders that has come together to organize this town hall tonight. Really amazing panelists. And joining me this evening is Rachel Montgomery. With that, Rachel, I'll hand it off to you.
Great, thank you, Michelle. Good evening, Curry County. I'm grateful to be joining you all for this town hall tonight from Wigi on the land of your neighbors to the south, the Wiyot people. I work alongside Michelle at Wild Rivers Community Foundation and Humboldt Area Foundation as a program officer for Community Solutions. And as a program officer, I have had the great privilege of getting to know and to work with so many of our community partners in Curry County over the last 2 years, including some of the panelists who are joining us for the town hall tonight. And if there's anything I've learned about the people of Curry County, it's that you all have a way of coming together in hard times and setting aside your differences for the betterment and the well-being of your neighbors and your wider community. And if there was anything to come together for, it's our community's children and their well-being. So in that spirit, we've gathered a panel of speakers this evening who share this value and who are committed to the health and well-being of Curry's children and their families. We're incredibly grateful to them for being with us tonight and for their incredibly important work with Curry County's children. And we also want to thank our ASL and Spanish interpreters with us tonight and the generosity of the Oregon Health Authority that made that possible. Back to Michelle.
So as folks join the town hall, we have a poll where we'd love to get your feedback. And there's a brief question which should pop up right about now. There it is. We'd like to know where you go to find information about COVID-19 that you can trust. So if folks would like to respond to this, we'll be following a pretty similar format to our previous town halls in the first half or so, and then we'll briefly hear from each of our panelists on the work of the organizations and relevant information that may be helpful for parents and caregivers of young children and how to navigate this current phase of the COVID-19 pandemic. After that, we'll have another brief poll just like this one before we move into a moderated Q&A session to answer questions submitted by the community as well as the live audience. So feel free to chime in with your questions and chat in the live Facebook feed as well. And just want to say thank you for all of those responses that have come in. And with that, I'd like to remind folks that we ask for kindness and respect in the space and remember the core values that bring us together, which are care for our community's young people. If you have any feedback for us organizing this event, please email us at info@wildriverscf.org. And just a reminder about this event, tonight's about providing consistent, clear, factual, and inspirational information about our community and COVID-19. With that, I'd like to pass it back to Rachel, and she's going to introduce our panel of speakers.
All right, let's get started. Tonight, we're joined by 5 wonderful folks who work with children and families in a variety of ways. First, we'll hear from Dr. Tom Jean, who is the Deputy State Health Officer and Deputy Epidemiologist for the Oregon Health Authority. After that, we'll have Sarah Stevens, who is the Director of South Coast Regional Early Learning Hub. as well as Jennifer Reed, who is the manager of Head Start for the Tallawadamie Nation, David Marshall, superintendent of the Brookings Harbor School District, and Mendy Kane, the co-director of Every Child Curry. And if she is able, family nurse practitioner Jackie Michael Havens of Curry Health Network will be joining us from the road for our Q&A session later this evening, if she's able to have a connection to the Zoom. And with that, I'd like to hand it over to Dr. Tom Jean for an update and information from OHA. Dr. Jean, you'll have about 10 minutes. And if we could have the slide shared.
Well, thank you so much. I appreciate the introduction, and I'm really happy to be here this evening with you all. So I'm going to try to go through a bunch of slides here in about 10 minutes. So I apologize if it's a lot of information, but I just want to provide a little context about where Oregon is in terms of the pandemic and COVID, and also some Curry data and Curry County specific data, and then talk about vaccines and treatments in particular. So let's go to the next slide. Okay, thanks. So this is from our data dashboard, and I wanted to point out at the bottom, I've got a link there to the OHA main COVID-19 website, and from that page, you can get a link to all of our data dashboards. There are a bunch of them. They're updated in many cases on a daily basis. So lots of information there, and you can also drill down and look at some Curry County specific data. But this is statewide data here. So the orange bars are showing the case counts in the state for the past 6 weeks or so. And you can see we really had a low level of cases in late March. That was our lowest level in many, many, many months. And they have been creeping up again statewide. Our 7-day average is now approaching 700 new cases per day. And then the red or purpley bars there is the death rate statewide, or death count actually. And you can see those have really dropped way off, which is really wonderful to see. And then at the bottom there, that's our the number of COVID-19 patients who are in hospitals statewide. Again, a similar picture where we were down below 100 a day, and it's starting to creep up a little bit right now. Next slide, please. So just putting this in context, though, where we were there, you know, I pointed out that gradual increase we're seeing in cases, but we have, can we get to the next slide? I'm not seeing it. There we go. Thank you. So this is just to put this in context. This is a case statewide over the past year, going back to last summer. And you can see the fairly big summer wave we had, and then just the tremendous Omicron wave we had in January and February. So where we are at the far right there, we're still at a very, very low level compared to the big surges that we've seen. Next slide, please. So here is county transmission levels, and you can see that Curry is doing relatively well right now compared to many counties. So currently in the moderate transmission level, just based on case rate and percent positivity. Next slide. And if you look at Region 3, this is how we break down our hospitals in Oregon. Region 3 includes Curry County and several other counties. And you can see there was a really big spike in the summer, a smaller spike with the Omicron surge this past winter, and the current COVID-19 patients in Region 3 are quite low like the rest of the state. Next slide. Let's go forward. Next slide. One more. Great, thanks. Yeah, one more past that. So then this slide here is just showing the vaccination coverage statewide, and Curry is not quite the top here, but kind of in the middle of the pack in terms of vaccination coverage. About 67% of Curry County residents have received at least one dose of vaccine. And like many places, that has really plateaued and kind of flattened out lately. But there are still new doses being added each day. Okay, so let's go to the next slide. I hope that was kind of just a summary of where we are. Again, I think where we are right now is a bright spot. Things are looking pretty good, but we are expecting some increase in cases. Now, we get lots of questions continually about vaccinations. So I wanted to go over some of the basics and some of the safety issues and things that people may be asking. So this table is just showing some of the basics of the different kinds of vaccines. The Pfizer and the Moderna are the main vaccines that are recommended. Those are both 2-dose vaccines. The Pfizer is the one that is approved or authorized for younger people down to ages 5. So that includes 2 doses. And then there's also a booster recommendation for those ages 12 plus for Pfizer and ages 18 plus for Moderna, and that's recommended 5 doses or 5 months after the primary series is completed. The Johnson & Johnson, or also known as Janssen vaccine, is the 1-dose vaccine that is still available, but generally less recommended in most cases. It's just not quite as effective. And next slide, please. So you probably heard a lot about second boosters because this is a fairly recent development. For people who are more advanced age, people ages 50 and older, and as well as people who are 12 and older with some kind of a moderate to severe immune system disorder, those are the main groups that may want to consider receiving a second booster dose. So that would be a 4th dose really of the Pfizer or Moderna vaccine, and that would be at least 4 months after their first booster. This is something that you should really, if you're in those groups, you'd want to talk to your healthcare provider to see if you should consider a second booster dose. Next slide. So we get lots of questions about vaccine safety. There's a lot of information out there. There's also a lot of misinformation. The bottom line is COVID vaccines are very safe, very effective. They have been studied in tens of thousands of participants in clinical trials. They have met the FDA's rigorous standards for safety, effectiveness, and quality. In terms of how many people have gotten these, it's pretty incredible. We've had more than 500 million doses in the United States alone. And that's actually 11.5 billion doses of these vaccines have been given worldwide. So that is just a tremendous number. And we from all the data in the trials, as well as all the monitoring that's being done on an ongoing basis, there are serious side effects, but they're extremely rare, really, really rare. And most of the side effects that people would experience are quite minor, arm soreness, maybe some fatigue, a fever, things like that. And the benefits of vaccination far outweigh the known and potential risks. It was interesting because we had a global pandemic, and we wanted to get these vaccines out as fast as possible. That does not mean that any corners were cut. These are really among the most heavily studied vaccines ever made, and under the most intense safety monitoring in U.S. history. So you can be confident that that these are safe vaccines and are going to give benefit to you, your family, and your communities. Now, in terms of children, of course, were not first included. They were not the first groups studied. So as we've rolled out the vaccine recommendations for children, there have been more questions. And I think that's just because they were initially recommended for older groups, and it took more time to get some of the data from the more recent trials that included kids. One thing I also wanted to highlight is right now, COVID-19 vaccines are not on the required school immunization list in Oregon. And part of the reason is that they're not FDA, they don't have the full FDA approval for all age groups in children yet. And that's just waiting for that whole regulatory process to be completed. Even at that point, it would still need to go through Oregon's vaccine process for adding vaccines to required school immunization lists. So that is really not on the horizon right now. So that is not something that will be required at least this year or next school year. Now, people talk about how kids generally do better with COVID, and it's true that serious side effects or serious complications from COVID are less common in children. However, we have had 68 cases of the multi-system inflammatory syndrome in children in Oregon to date. So that's 68 kids who have been hospitalized with a severe illness involving multiple organs. And we've also had 6 deaths from COVID in children in Oregon to date. So it's rare, but it does happen. And again, the benefits of this very safe and effective vaccination are really far outweighing those risks for children as well. You may have heard about myocarditis. That's an inflammation of the heart muscle. That does appear to be a rare side effect from the vaccines. It's also a rare side effect of COVID. The immune system can basically get confused and start attacking the heart muscle. The great news, though, is those are rare, and in almost every case, these kids are recovering fully and doing very well. So not a reason to not have children vaccinated. Okay, so I'd like to move on now, and I'll be available to take some questions later, of course, but I want to keep things moving. Next slide, please. I just want to go through a few slides on therapeutics. Next slide. So these are treatments for COVID, really aimed at people who are at high risk for severe illness. That would include hospitalization or death. There's two main categories. There's the monoclonal antibodies, which are basically a way to help the immune system recognize and respond more effectively to the virus. There are 4 of them out there right now that the FDA has reviewed. These are typically given IV or as a shot. And then there is one out there that's also currently authorized for prevention of COVID-19 in people who have a recent exposure and may have a really high risk. Then there's the antivirals. These are medications usually taken by mouth that would target specific parts of the virus, help reduce its multiplication, and basically also help the body fight it off just by killing the virus directly. These generally need to be taken within 5 days of getting sick. And one of the ones you may have heard about is Paxlovid, which the FDA authorized in November. Next slide. So how can you get treatment? Well, really the best thing is to talk to your healthcare provider. These are, of course, prescription medications, and they can help you work through what might be appropriate for you based on your health history and your situation. We do have more information on our website, the link there. And there are some fact sheets, infographics, things you can look at to kind of educate yourself about therapeutics. If you don't have a healthcare provider, you can call 211. We've got some other information there as well. And on the next slide, we have a link to the federal government's Test to Treat program. And that's basically a website where you can type in your zip code and find participating sites that will actually be able to test you and potentially prescribe an antiviral and give you the medication all in one visit. There's also the Federal Retail Pharmacy Therapeutics program, where you would have a healthcare provider send a prescription to a participating pharmacy, and the sites are listed on that same locator at the link above. We are currently exploring adding some additional sites to that locator to really improve access in rural areas that it would include Curry County. Currently, no federal pharmacies are participating in Curry County, but we're working on contacting sites and adding some of those in the coming weeks. Okay, I think I'll leave my last 2 slides for potentially Q&A session. So I think I'll turn it over to our next speaker. So thanks for your attention.
Thanks so much, Dr. Jean. Next, I'd like to hand it over to Sarah Stevens, who is the director of the South Coast Regional Early Learning Hub. Sarah, you'll have about 5 minutes. Thank you.
Hi, good evening. I'm so happy to be here. My name is Sarah Stevens, and I am the director of the South Coast Regional Early Learning Hub. We also like to call it the SCREL Hub. We are the regional hub for statewide initiatives in Curry, Coos, and coastal Douglas counties. At SCREL, we promote programs and services that support young children and families. During the pandemic, families have been facing more issues than ever. I tend to find that even though we may be resource poor here on the South Coast, we are relationship rich. To get things done on the South Coast, we partner. We've worked hard during the last 2 years to align services, support program expansion, and make it easy for families to connect to programs that support them and their children. And we're doing it in a couple of new fun ways. First, we try to know everything. Well, not everything, but we like to know everything that's available for young kids and families. In the last 2 years, we've hired a full-time family navigator. Families can connect with our family navigator by phone, email, or text. She's a mom herself and is excellent at helping families navigate program options and community resources. Vanessa is bilingual and she'll be an advocate for you and your family. We also update our Facebook often. We provide tips, information, and links to area programs and other resources. We also have a new website where we've worked to make it easy for families to click through and explore resources on their own. There's an interest form you can fill out, and one of our amazing staff will contact you to help your family. This is a place families can sign up for new programs in our region, like Preschool Promise and Baby Promise. These are state-funded programs that provide programming for infants, toddlers, and preschoolers. Actually, one of these programs operates out of the Brookings Harbor School District with Mr. David Marshall, who's on the phone with us tonight, and in partnership with South Coast Head Start, which we couldn't have the program without that school district partnership. Facilities are a challenge when looking at childcare expansion here on the South Coast. School district partnerships like this one are key. Another cool school district partnership is with Port Orford School District. The school district and Head Start partner to provide additional preschool spots to help more kids enter kindergarten ready to learn, regardless of income. The Port Orford Main Street group has been doing some cool new work related to childcare, and our strategic initiatives coordinator, Skylar Scully, has been working alongside them to help stand up a new preschool program. We're in the planning phase with Central Quarry School District in Gold Beach on some early education options and look forward to future work and partnership there. During COVID, one of my favorite area programs closed, Healthy Families Oregon. Healthy Families Oregon is an evidence-based home visiting program that promotes resilience and support families in their individual needs. We're working hard with the Early Learning Division to bring this program back so it can be a resource to families in Curry County. A pivot we made during COVID was to offer parent cafes via Zoom. Families can build parenting skills, build confidence, and it supports resilience. They're offered in both English and Spanish, just monthly through the summer and more frequently during the school year. These group settings are structured small group conversations called cafes that promote the 5 protective factors, which are parent resilience, social connection, concrete support in times of need, knowledge of parenting and child development, and social emotional competence in children. This peer-to-peer learning process has families working together to grow stronger. We also provide investment funding to area programs that provide resources for kids and families age 0 to 6. We invest about $150,000 a year in these programs. Some other efforts that are happening, including ways to address childcare shortages and some of the challenges programs are facing with workforce, include a childcare accelerator program. This is a 10-week training program meant to train individuals interested in starting a childcare business. Participants will get a $5,000 incentive bonus at the end of the training to help jumpstart their childcare business. Partners on this project include Care Connections, the Child Care Resource and Referral Agency, Southwestern Oregon Workforce Investment Board, South Coast Business, and Wild Rivers Coast Alliance. We also are starting a new childcare apprenticeship program here on the South Coast. This is a strategy to help grow our own childcare workforce. This is a partnership between many of the partners just listed above. We're really happy to be here tonight to help talk about some of the resources available for kids and families, and we hope to connect you with resources that fit your family's needs and your child's interest. I'll put a link to our website in the chat, and we look forward to talking with you.
Great, thank you so much, Sarah. And I want to remind our audience, we'd love to hear from you. Any questions you have for our panelists for later on in our session, you can submit those in the chat here on Zoom or in the Facebook Live comments. So thank you. Next, I'm happy to welcome the manager for the Head Start program for the Tallawahdaini Nation, Jennifer Reed. Shoot shot, Jennifer, for being with us tonight.
Aloha, everyone. Yes, my name is Jennifer Reed. I'm the Head Start manager at Hawumkwet Early Learning Program at the Tallawahdaini Nation in Smith River. We are both a tribal Head Start program and a tribal preschool. Our Head Start program offers thematic, student-driven lessons, field trips, and outdoor experiences for children and families ages 3 to 5. We have a 3-year-old frog classroom that really helps students get used to the basics of school, learning, and working together alongside their peers. And then we have a 4 to 5-year-old classroom, our spring salmon classroom, that's focused on getting students ready for kindergarten. We have a tribal preschool program that kind of works in conjunction with our Head Start program. The tribal preschool classroom is open year-round, starting at 7:30 a.m. to 5:30 p.m., offering before care and after care for our Head Start families. But many families also choose full-day daycare for children in our tribal preschool classroom, because we start with students or children at ages 2 years, 9 months, and the low cost. We only charge $4 an hour for daycare. We enroll all students and families in Del Norte and Curry counties. That includes both tribal members and community members. Thankfully, we were able to open at the beginning of the school year for in-person instruction, and we attribute that to our strong mitigation strategies. So since a majority of our funding comes from the Office of Head Start, we do adhere to a masking and vaccination policy. All of our staff are either vaccinated, or if they're exempt, they submit to weekly testing to help us monitor the health and safety of our staff for students and families. All staff and students also adhere to a masking policy. So staff and students are masked at all times, with the exception of eating. So that's breakfast, lunch, and snack, napping, and outdoor time. We recognize that the last 2 years have so severely impacted, especially this graduating class who's heading off to kinder. So we try as much as possible to bring the school back to quote unquote normal operations, offering an experience to students, families, and the community that's connected to our local school districts, and of course the heart of everything that we do, the Tolowa culture, traditions, customs, and language. I'm here in the Q&A session to offer any questions that you might have. If you're thinking about your pre-K options, if you're ready to enroll now, or you're thinking about pre-K for the future. Thank you so much. Shijanila.
Thank you, Jennifer. Now we'll be hearing from the superintendent of the Brookings Harbor School District, David Marshall.
Hello, everyone, and thank you. I've been really enjoying just listening to a lot of the earlier speakers. So with Brookings Harbor School District, first of all, thank you, Sarah, for your earlier comment. We are always looking for opportunities to collaborate to expand resources and access to our community members and our students. Overview and background is Brookings Harbor School District, as well as all of the other school districts in Curry County, as well as around the state, have been focusing a tremendous amount of resources and energy on essentially what we call academic recovery through the interruptions over the last 2 years with our students' learning and their instruction, as well as I would say, a renewed and substantially increased focus on supporting our students' social emotional learning needs. So I'm going to speak for a few moments on just the particulars, kind of the technical COVID parts, but I just want you to make sure you're aware that that has been and continues to be the foundational piece of the work that we're all engaged in, very deeply engaged in, and certainly in Brookings are doing a tremendous amount of ongoing efforts to support the students and our staff in those areas. So with regards to COVID, let me just walk you real quick through this current school year that we're in. With schools in Oregon, we are under what's called, there's been different names for it. I refer to as Ready Schools, Safe Learners. So that's the Department of Education working with the Oregon Health Authority on establishing the rules for schools and school operations with COVID requirements. So that's been the case since the start of the pandemic, at the start of last school year, actually not the very start of it, and continues to be the case, and those rules have evolved and changed over time. So at the start of this school year, all students and staff were required to wear masks in all Oregon schools, Brookings included. And then another key event in October of this last year, so October 2021, the governor instituted a mandate that all school staff and volunteers be fully vaccinated. With that mandate for COVID, with that mandate, there is also a provision for people to request a religious or medical exception to the vaccine, but that's a process and steps that those individuals needed to go through. That rule continues to be in effect, and as of right now, the Brookings Harbor School District has, I would say, approximately about 85% of the staff are fully vaccinated, and then obviously the remainder of them have requested and been eligible for one of the exceptions. And so throughout the school year, that's how we were operating with the rules under Ready School Safe Learners and with students and staff wearing masks. And then effective in March of 2022, so just a little over a month ago, the school mask mandate changed to a recommendation. So it was no longer a requirement. In Brookings, we made sure we communicated that it was both for staff and students their choice, and that their choice would be respected. The school does still continue to provide masks for anyone who wishes, but they are no longer required for indoor or outdoor activities or in class. And we still do have a number of students and staff who prefer to wear them for their own personal needs. So what we've experienced since then, as Dr. Jean has mentioned, is, touch wood, fortunately so far, when the mask came off, we did not see in schools any dramatic spike in cases. So where we are with the rules at the moment is if a student or staff member tests positive, they are isolated and they have to stay home for the isolation period of time, which I believe is 10 days. But beyond that, it's essentially the masks are recommended, and basically the additional cleaning and sanitizing that we've had in place for the entire duration. In addition, our school district's been able to, using some of the federal relief funds, is been a complete overhaul and update of our HVAC system. So all of our HVAC actually has active virus filtration in it now. We were able to get that installed over last summer. And we've also using that same money source to update all of the drinking fountains so that they're all touchless drinking fountains with bottle fillers and whatnot. So to continue to support that. And so for the moment, that's where we are, and we certainly hope that the numbers continue to stay, comparatively low for school settings, and then able to essentially, I think someone else mentioned earlier, kind of continue to go back to operating as normal. So I think I covered the main things, and I want to thank you for your time, and we'll certainly be available for questions afterward as well. Thank you.
Great, thank you so much, David. And next, I'd like to pass it on to Mendy, who is a co-director of Every Child Curry, which is a program of United Way of Southwestern Oregon. Welcome, Mendy.
Good evening. Thank you for having me tonight. Every Child seeks to uplift children and families who are impacted by foster care. And so we have several on-ramps and support avenues for families who are either fostering or have an open DHS case. The My Neighbor program was launched in response to the crises of the pandemic. Many families at this time were isolated and were struggling to even find groceries and tangible needs. And so this program was instituted to support families who were impacted by foster care, where they could submit a request for a tangible need. It might be groceries or clothing items, or even a mattress for a new child coming into care. And so they submit that request, and we pass that on to our donors and our supporters in the community. And we have found Curry County to be over the top generous. And so we have seen such an amazing response from our community in coming around foster families. Just to give you a few stats, Last year, we were able to meet 68 needs in the community, and that totaled $21,000 in tangible needs to support families who are impacted by foster care. And if you're interested in providing some support, I do have a link that will be dropped in to the chat for the My Neighbor program. That is the public site that you can select a need and pledge to meet that need. And then there's instructions on where to drop it off at our anchor site. Another way that we have supported families who are impacted by foster care is providing respite care. We have several programs available for our families. One is our tutoring and enrichment program. And this was launched during COVID in response to the crises that our families were facing when they were suddenly homeschoolers, schooling their children at home and struggling. Some of our families were struggling greatly in trying to balance everything, and then also seeing the isolation that the children were going through. And so the tutoring program was launched at this time in small group settings to be able to have a one-on-one tutoring relationships with a tutor, and then also be involved in enrichment programs. STEM activities that involved science, technology, math, all of that was engaged. They were engaged in these activities for a 2-hour program to provide social support, and then also academic support and respite for the families. And that is continuing to be a strong program here in our community. This last year, we enlarged our reach to be able to serve preschoolers as well. And so our program reaches preschoolers through grade 12, where kiddos can come for a 2-hour session with a tutor and also involved in that enrichment program. A second respite care program that we have seen being so successful in our area is the Foster Parent Night Out. This is a monthly event where families can drop off their children in a safe place for about 3 hours and have some time together. And then the kids are engaged in some fun activities and building relationships with our volunteers. We're able to do all of these programs free of charge because of our great volunteer base and also incredible grant funding that we've been able to engage in. So we're grateful for our donors and our volunteer staff. A third engagement that I'd like to share with you is our Explore Fostering Coffee House. And this is an event that is designed to answer questions that families might have who are considering foster care. We offer these events in both Brookings and Gold Beach. Our next one is May 23rd at the Wild River Pizza restaurant here in Brookings. And this event will also be a volunteer connection. So if you are wondering where you might fit on the team in a volunteer aspect, we would love for you to join us. Or if you have a question about what fostering is all about, we'll have current foster families there as panelists and also certifiers from our ODHS staff who can answer your questions and give you some honest answers. We are thrilled to be able to support our families who are impacted by foster care, and we're grateful for a community that has been so generous and so supportive of the work that we do at Every Child. I'm going to be available at the question and answer time. If you have any questions, please drop them in the chat, and I'll be happy to answer them. Thank you.
Thank you so much, Mindy. And thank you to all our panelists for sharing, not only sharing about what your organizations do and your amazing teams, but for joining us tonight. Before we move on to the Q&A session and the last half of our town hall, I want to remind our audience, again, if you have questions for any of our panelists, please share in the chat in Zoom, or if you're watching with us on Facebook Live, in the comments there. We do have a great team of folks here moderating those questions, so please get them in if you have them. But before we move on to our Q&A session, we want to share another poll. We'd like to get some feedback from you. This is another super brief question, and of course, these are all anonymous. This question is, on a scale of 1 to 5, how easy or difficult has it been for you to find COVID vaccines for children in Curry County, with 1 being incredibly easy or 5 extremely difficult? And you should see that poll popping up shortly. And thank you for your responses. Now Michelle will bring us to the last half of the evening, which will be a chance for our panelists to answer some questions from the community.
Sorry, I was answering the poll. It was popping up for me. All right. Yes, really appreciate all the panelists tonight. What a wealth of information. So as we get into thinking about some of the questions that we've seen, I think this first one we'll go ahead and toss out to Dr. Jean. For those without a computer or internet, how can they get in touch with OHA to get COVID information?
That's a great question. I think you know, the internet, our website is probably the easiest way. So if you have access to a library or a way to get online there, that would be one way. I believe we have perhaps a phone number, but I don't have it handy. So maybe somebody else may be able to get that, or we can put an answer in the chat.
Thanks, Dr. Jean. Yeah, we'll make sure that number gets in the chat. And maybe a follow-up for you would be, can you talk about what some of the common side effects are for children getting the COVID-19 vaccine? And have you seen them vary by age group?
Yeah, that's a great question. You know, the typical side effects that you'd see for anybody, including children getting a COVID vaccine, are pretty much the same type of minor, mild side effects you'd get after any routine vaccination. Mild, temporary, things like a sore arm, fever, fatigue, etc. So that's the most common thing that you'd expect. As I said, these have been studied and are totally safe, or at least they're extremely safe for children in the age groups that they've been authorized for. And the serious reactions that we've seen have been really, really rare. And in many cases, even the more severe reactions like the myocarditis that I mentioned are proving to be pretty self-limited, and kids are recovering very well from those. So generally, I would just keep an eye out for the basic routine things. And if you have questions or concerns about something that looks like it might be more severe, then definitely contact your healthcare provider.
Great, thank you so much. And just looking in the chat here, it looks like we've got that information to the phone numbers is there. Thank you so much for posting that. And looks like as well, there was a wealth of information from panelists. Just as a reminder, this whole session will be recorded or is being recorded. And looks like we've got some good information exchange as well for folks that would like direct email. So the next question looking at this is there a fertility or other developmental risk to vaccinating children for COVID before they reach puberty?
That's a great question. You know, there's really no physiologic reason that we'd be concerned about that. You know, many routine vaccines, in addition to the COVID vaccine, have been given to children, you know, from close to birth to you know, adolescence, and they've been studied and monitored, and that kind of concern just really hasn't happened, and there's really no reason to to expect that to be a side effect of the COVID vaccines either. Given the number of children that have been included in the trials and are continuing to be monitored, we would have seen some signal, some indication that there was something like that happening, I think, if it was a risk. And we just haven't, but we will continue to monitor this. The FDA is, and globally, authorities around the world are looking closely at all reports of adverse events after vaccines to look for any kind of association. The thing to remember is just because something is reported as an adverse event after a vaccine doesn't mean the vaccine caused it. It could have been a coincidence, and that's why you need to look at large numbers of these reports and look at the data and actually run some analyses to see, is this more than we would expect, or is this just kind of the background level of unfortunate severe outcomes that just do happen to people unrelated to the vaccines. So I do not think there's any concerns about fertility or anything developmental in children from the COVID vaccines.
Thanks so much, Dr. Jean. So this next one really is for Mendy, Sarah, Jennifer, David. I think if each of you have a response to this, you might have some varying responses to it. It'd be great to dive into around what supports are available for children struggling socially or emotionally with the impacts of the pandemic.
Yeah, that's a hard one. I do think that just overall there are a lack of resources in general for kids and families, and so things like South Coast Head Start or the Preschool Promise program that we spoke about, or the Baby Promise program are all really consistent ways for your child to receive some support, with some social emotional support, and get to know other kids and play with other kids. There are some summer activities that I think will be happening this summer, and some other one-off programs that we're working to fund. And you can find out about all of those programs either on our website or through our Facebook page, or by contacting our family navigator.
And I would say, I smiled when you said summer programs. Yes, that's coming out soon. And there's actually, I don't know if it's directly related to this, but there will be a fairly wide range of summer opportunities for our kids in the community again. And so that information will be coming out shortly within the next couple of weeks. Everything from summer enrichment to basically camp type activities. In terms of students, our students struggling with some social emotional issues, I would say in the school setting, the first place is with the teacher, and then each of our schools does have a licensed counselor. And so those are our kind of first few steps, is to work with children and their families through their difficulties. And then if they're still struggling, or maybe it's things beyond the school setting, then we tend to reach out to other organizations and try and facilitate and help support those conversations. So again, first stop for schools is starting with our school staff, and then if the needs are still unmet, then we work to directly connect with other organizations.
This is Jennifer at Holland Early Learning Program at Talawedeni Nation. We teach a social emotional curriculum called Second Step. That's great for all students. That introduces them to the beginnings of positive communication, how to behave in the classroom, cooperative learning and collaboration on projects. We also utilize dramatic play in our center rotations so that students get the opportunity to learn how to work through each other through different play experiences. And those are things that we rotate on a weekly, even daily basis to keep it fresh and fun for students.
This is Mendy with Every Child, and all of our volunteers are trained in trauma-informed care, ACEs training. And this is something that's very concerning for all of our volunteers, to be able to care for kiddos that are in care that have experienced trauma. And so it's a great question and something that our leaders are very much addressing in our context of caring for children who are in the foster care system.
Wow, thank you so much. Yeah, gosh, it is a really hard question for sure, and definitely always wish for more resources to support. And just really thank you so much for sharing the different ones that are. Look forward to seeing some of those guides and information come out, and we'll be sure to help share those. So with that, I think we're going to go back to a little bit more around where, thinking about information and looking at this, where would you recommend parents go to get COVID information? I'm really opening this up to anybody with like information. What are some of the sources? Where do you put the information, and where should parents go to get their updated sources?
Well, I would just say that, we did put in the chat, for people who don't have internet, calling 211 is a way to get questions answered about COVID or finding vaccines, finding treatment, finding healthcare, things like that. But on our website, we do have some really great information. For example, getvaccinated.oregon.gov for information on vaccines. Our general COVID page, I believe that link is healthoregon.org/coronavirus. That has lots of information, the data dashboards that I included in some of my slides, questions about symptoms and things like that, and more resources. And then finally, there is the safestrong.oregon.org website that also has some really good information. And we also have some things available in Spanish and multiple languages. So those would be my go-tos. I would also add that the CDC, which of course is the National Public Health Organization, they have a lot on their page too. That their general COVID page, you can just Google or search for COVID and CDC and any other questions you have.
Thanks so much, Dr. Jean. David, Marshall, I was curious, if anything from the school you might be able to share.
So we publish and maintain essentially direct information. So like numbers of cases, when those things happen. So those are all maintained and communicated out on our website. And then primarily for the technical information, our website refers to the websites that Dr. Jean mentioned in the Department of Education and the state guidance, Ready Schools, Safe Learners. So we publish local direct information, again, like numbers of cases, and then also have those links referring on, so it can be a good clearinghouse as well.
Thanks so much, David. Well, we've got a live question here. I'd love to throw this one in. So since hiring the family navigator, what feedback have you received from people who have utilized her help? This one's for Sarah Stevens.
Families, the feedback we've received is that families really love connecting with Vanessa. Again, Vanessa's bilingual, and so she can speak to families in English or in Spanish. And there's so many different places that you can go for information or to find resources. And families have found that it's really nice to contact a live person who lives on the South Coast, who she herself has young children and has navigated some of the programs that exist for her young kids, and can really just build a relationship with you and find out exactly what your family needs. And oftentimes it's more than one thing, and we have great community partners to connect you to whatever your family might need.
Thanks, Sarah. So another question that we've gotten was, there's two parts to this one. So one is, when are we to expect the vaccines coming available for children under 5? And then the next part of that is, then what are some of the methods of delivery? Is it going to be a drive-through, Are there other ways that kids might be able to get vaccinated under 5? Wondering, Dr. Jean, if you could kick that one off for us.
Yeah, sure. It's a great question. You know, the first vaccines for adults came out, you know, almost a year and a half ago, and we're still waiting for the youngest among us to have vaccines available. This is all happening at the federal level. The FDA is reviewing data from the vaccine manufacturers. It's Pfizer and Moderna working on this, and from what I've been able to gather, they're basically using smaller doses for these youngest children. And it looks like the initial dose they chose was actually a little too small to really be highly effective. So they're working on studying a third dose for them, and they just need to collect more data. So no concerns about safety, just really making sure that the vaccines will be effective once they're authorized for the under 5 age group. And then, you know, I think for children, you know, we've got all sorts of ways that people can get vaccines in general, that it's a little bit different for the youngest age group. But I think a lot of the local partners, pharmacies, and some community-based vaccination sites will all, and that will probably include a drive-through option. Even though those kids can't drive themselves, a parent's able to drive them through. That would be one of the easy ways to get vaccinated. So we'll keep on top of the federal authorization for this age group, and we'll make sure that we have good information out there as to where to get vaccinated for that age group. And again, getvaccinated.org and .gov will be a great place to get that information.
Thanks so much. We've got a couple good ones coming in here. I've got another on what is long COVID and who's at risk for it?
Oh, okay, I'll try to tackle this one. So long COVID is something that has been in the news for quite a while. It's basically just the term for any kind of post-COVID medical conditions. There's really a wide range of health problems that people can experience after being infected. And once it gets to be about 4 weeks after your infection, that's when we start to consider maybe that it's a long COVID type thing. There could be new symptoms that people might develop, including difficulty breathing, fatigue, cough, or some other things like difficulty thinking, kind of a brain fog. Those are things that we have seen from people who had COVID. There's also multi-organ and autoimmune effects where, you know, you can really get a little more severe illness involving multiple organ systems, heart, lung, kidney, things like that. And then the autoimmune, that's where your own immune system is attacking healthy cells in your body, basically by mistake, being confused, and that can cause inflammation and damage around the body. So there's quite a range there, and they can happen in children and adolescents, although less common than in adults. And then there is pretty clear evidence now that vaccinated people who do end up getting infected after they're vaccinated are much less likely to actually report any kind of long COVID or persistent symptoms after having that infection compared to unvaccinated people. So really the best way to prevent post-COVID or long COVID symptoms is to get vaccinated.
Wow, definitely something serious not to mess with, and a lot of preventative ways that we can protect our families and ourselves. So I think one of the final ones, we've talked about this as a pandemic, and we've started to hear the word endemic. Can you tell us a little bit about kind of the stage we're at right now and what it means for a virus to become an endemic?
Sure, yeah, these words all kind of sound the same. So, I mean, pandemic is basically the term for a global, multinational epidemic. I think most people have a sense of what an epidemic is. It's basically when you have cases of a disease that are much above a baseline level, or a new disease like COVID that just comes out and spreads rapidly. So we are still at pandemic. We're still in really the acute phase of the pandemic. We are moving towards what's called endemic. We're not there yet, but endemic would basically mean you've got this infection that is still prevalent in the community, but it's at kind of more low levels less disruptive to people and communities. But you can still get epidemic periods during in an endemic setting. So I guess what I would just emphasize is that the pandemic is not over. COVID-19 is barely more than 2 years old, which might be hard to believe given how long it seems. And there isn't a set threshold really that dictates when the pandemic will be over. But I will say that I think we are in a brighter spot now. We're gonna see some increase in cases. We're not totally done with COVID, but I think things are looking much brighter, and the worst is behind us. But I don't think that we can say that this is just a routine seasonal virus at this point. It's still a bit unpredictable, and we still have to be careful and really do our part to get vaccinated, wear a mask if you're at high risk, or you're in a setting without good ventilation with a lot of people, and we'll get through this together.
Well, you've heard it from Dr. Jean. We still got to stay vigilant. Really, to each of you, the panel tonight, so much gratitude for the work that you have done, leaning into collaborating, folks rolling up their sleeves and working together. It's really some amazing resources, and appreciate all of your knowledge and expertise this evening. Thank you.